Hello everybody, you are watching Dr. KK's Med Talk show. Let us have the headlines for the day. So as we talk today in the uh, uh, in our Jopa show, we clearly know that we are today on the 562nd show of Dr. KK's Med Talks. And this show is dedicated to Sir, our Dr. late Dr. KK Agarwal. And we clearly know that today, as we talk, Indian vaccination program is going leaps and bounds. 162 crore Indians have crossed the vaccine coverage, and 62 lakh doses have been administered in the last 24 hours. All the poll-bound states in India have a vaccination deadline to at least vaccinate every eligible poll uh, star who's going to cast a poll at least with the first dose. That's a mandate of the Election Commission, and that's something which is going to be not an easy target to vaccinate, but that's something which we know. We also know that a WHO Director General, Dr. Tedros, has said that Omicron may not be the end of COVID. It could still have a eventuality with another strain which may come up. So it may be dangerous to assume that last variant may be there. Our third wave, though in cities of Mumbai and Delhi is showing a plateauing and a decline, the urban districts are still reporting high numbers, but the rural India is still, it may spread there. So it is going in a cluster, it's going like wave and wave. Say, for example, Mumbai, Delhi, now to MMR and NCR, then it will go to semi-urban areas, then rural areas. That is what is happening. We know that on February 11th, UK will not require any testing for fully vaccinated people on arrivals. Of course, if you are not vaccinated, you will have to take a pre-departure PCR test on or before second day once you arrive. So today's topic is going to be on air ventilation, humidity and pollution, because we are seeing a clear change in the climate. And because we are clearly seeing a change in the climate, we decided to discuss this topic of air ventilation, humidity and pollution in COVID-19. We all know that this is a Jopa show, and my very close friend and colleague, a senior colleague of ours, Dr. Rahul Pandit is joining on the show. Dr. Rahul Pandit is a senior critical care intensivist, one of the foremost intensivists in India and Australia. He is clearly the director of critical care medicine at the Fortis Hospital in Mumbai. He's the Supreme Court nominated task force member at the national level. He's also the Maharashtra Active COVID course member. He has done some pioneering work in sepsis, oxygenation, and COVID critical care. Welcome, Dr. Rahul Pandit. And
Thank you, sir.
we will definitely be discussing today's topic. But before we do that, I would like to ask Dr. Pandit a very simple question. That now that we are in the thick of the tsunami of the third wave, we are in the thick of the tsunami of the third wave. We have a harsh climatic conditions, whether it's Delhi or Mumbai or across India. Mumbai had a dust, it had a chill, it's winterized, it still has some pollution, and we still have Omicron and COVID around, and so is north of India. How do can you give us a quick overview of the situation before we go to the core of the topic, which is linked to air ventilation, filtration, pollution, etc.
Sure. Good evening, sir. And again, I would like to start off by introducing Professor Dr. Shashank Joshi. Professor Dr. Shashank Joshi is a Padma awardee, a renowned endocrinologist across the globe. Excellent publications, more than 670 publications now in major journals. A very key opinion leader in terms of endocrinology, diabetes, metabolic disorders, and obesity. He has been the voice of Maharashtra COVID Task Force. He is nationally renowned and has been honored by being called on the Man Ki Baat by the Honorable Prime Minister. So, sir, coming to your question, I think we all know now that the Omicron wave started in clusters in the metropolitan cities where the density of population was extremely high. It got compounded by the fact that it started in the winter, where we always see the winter diseases, which is your cough, cold, fever, viral diseases, upper respiratory tract diseases, at a very high percentage as compared to the rest of the year. And what we saw is that in these densely populated cities of Mumbai, Delhi, Kolkata, it had a very, very sharp rise. And then within a matter of around 3 or 4 weeks, it plateaued down with numbers clearly coming down in at least Delhi and Mumbai. There is no doubt about that. However, we should not be dropping our guard right now because it's right now spreading to the tier 2, tier 3 cities. Bangalore, Hyderabad, Pune are showing a very sharp rise in the cases. And what is a concern is that we have a rural part of the country, which now is probably going to be the next affected areas. And we all know that when rural part of the country has got cases, some of them actually flock back to the city. We need to keep our guard very high, because if you can see that there have been some reports today of a slight upward trend in the United Kingdom of the cases, and that's a worrisome trend which I am seeing. Also, we need to be aware of the fact that there are variants of Omicron which are already been described, and they are prevalent in the country. BA1, BA2, BA3. We do not know about the reinfection. I'm not even trying to hint that there will be a reinfection, but these are some of the scientific worries which we have. And whatever happens, you cannot keep the science aside. We have to keep the science in the mind and plan our move forward. So before we come to our main topic, I think my message here is that don't let your guard go down. We are in the thick of the pandemic. While things are looking a little better in the high density metropolitan cities, the tier 2 cities, the tier 3 cities, and the rural areas are still into the stage of surging up, while some of them may have already surged up quite significantly. For example, Bangalore seems to have one of the highest peak among all the big cities in the country. We need to be very, very clear that masking, vaccination, double masking, vaccination, and then the topic of the day, which is the ventilation and air pollution, are going to play a key role in how well we can curb this pandemic down, and the third wave can be controlled in a better way. Back to you, sir.
So thank you, Rahulji. You make some very pertinent points, and I would like Manmeet if he could put up some slides. Today's core topic is linked to a topic which I have dedicated this to Dr. Agarwal. Dr. Agarwal, he was very, very passionate about it. Air ventilation, humidity, and pollution in COVID-19. Next slide. Let us look at some data. There are 3 C's we all know: crowded places, close contacts, and confined enclosed spaces. These 3 spaces are the ones where there is a risk of transmission. So even when the restrictions are going to be lifted, if you have to stay safe, it is the crowded places, the close contact environment, as well as confined enclosed spaces with poor ventilation, which are the spreading 3 C's which we see with COVID. Next slide. So clearly activities that increase the risk of infection, being indoors rather than outdoors, and in the indoor environment where the ventilation of outside air is inadequate. So if we don't have circulating air from outside, then those activities that increase emission of respiratory fluids. For example, if you speak loudly, if you are singing, if you are exercising, then people emit 100 times small aerosols, less than 5 micrometers, during talking, during singing, during speaking loudly, during breathing, during coughing. And if there is a prolonged time of exposure, particularly Omicron is very contagious. It is, as Rahulji said, there are different types of sublineages. It is as contagious as a chicken pox or a measles. A few exposure time, a few minutes will allow the spread. Obviously, in crowded spaces also, if the facial covering is not properly worn or inconsistently worn, remember these small droplets, the airborne transmission through airflow in the room and exhaust duct stay suspended for long hours. And then they get transported in long distances. The size of virus is only 0.1 micron. So on indoor surfaces, it remains active for 48 to 72 hours. And that is where the challenges become, that they become airborne and they get carried in our air conditioning systems. This is one of the key features as we go along. Next slide, please. So there are aerosol generating procedures which produce small droplets which stay suspended in the air for a long period of time and they can spread beyond a conventional distance of 1 meter and generate high concentrations than coughing, sneezing, talking, and breathing. Medical procedures can do that. Suctioning of airways, which Dr. Rahul does in the ICU, sputum induction, cardiopulmonary resuscitation, endotracheal intubation, which we do in the hospitals, bronchoscopy, ventilation, non-invasive ventilation like BiPAP, CPAP, all of them are aerosol generating. Next slide. Now look at the size. Coronavirus size is 0.06 to 0.14 micrometer. HIV is 0.1 micrometer. E. coli is 0.1 micrometer. If you look at particulate matter, 2.5 is 2.5 micrometer. The red blood cell is 7 micrometer. And you can see particulate matter 10 is 10 micrometer. So if you see the size of Omicron or SARS-CoV-2 is 0.01. Very, very small. Next slide. Next slide. So there are three basic strategies to improve indoor air quality. One is to control the source. Second is most home heating and cooling systems include forced air heating. They do not mechanically bring fresh air into the house. So opening of windows and doors, operating window or attic fans whenever the weather permits, or running a window air conditioner with a vent control open increases outdoor ventilation rate. Local bathroom and kitchen fans that have exhaust remove contaminants directly from the room where the fan is located. So simply having an exhaust fan helps. Okay, and ensuring that there is adequate circulation of air helps. Then there are air cleaners, because you know that air cleaners, they depend how well pollutants from indoor air, which is expressed often as a percentage efficiency rate, and how much air is drawn through cleaning and filtering, which is expressed as feet per minute. So obviously a very efficient collector with a low circulation rate will not be effective, nor will be a cleaner with a high air circulation rate. So we need both. We need high circulation and we need efficient air cleaning. So controlling the concentration of indoor respiratory aerosols to reduce airborne transmission is going to be the key. It is not just going to be masking or distancing, but engineering controls on ventilation and filtration is the key now. And that is where we are going, because we have to open up. We have to open up for economic activities, we have to open up for educational activities, we have to open up our schools and colleges. So we have to ensure that when we are opening up our environment in indoor environment, closed space, how do we do right engineering of ventilation and filtration so that we can control the indoor air quality. Next slide. So obviously there are different techniques to improve air quality. Distance is just one of them. Humidification at 40 to 60 degrees. I'll talk to that. Purified air circulation, disinfecting intervention, ventilation from the open air, indoor plantation, use of mask, portable air purifiers, and IAQ monitoring. All these are different ways of improving air quality. Air quality is very important, particularly in winter time now. Next slide. So let us look at ventilation. Next slide. So obviously there is natural ventilation through windows and doors. Then through mechanical, the outdoor air can be intaken through heating, ventilation and air conditioning system. This is called as HVAC system, which is heating, ventilation, air conditioning, HVAC. And then through infiltration, a process through which the outdoor air flows into the house through openings like joints, cracks on the walls, floors, ceilings, around the windows and doors. And infiltration can occur across the homes to some extent. So there is infiltration, there is mechanical means, and then there is windows and doors through natural ventilation. So this is how the air quality of a room is determined in an indoor space. Next slide. So to improve ventilation in your home, because first thing is we all live at home, and then we live in an office, and then we live in a school environment or a college environment. Open the windows and screen doors. Do not open windows and doors if they pose a safety or a health risk for children or family members, like risk of falling or triggering asthma symptoms. Operate a whole house fan or an evaporative cooler if you are at home. Operate a window air conditioner or an outdoor intake or a vent open, or you can also get portable air conditioners now. Try to use the HVAC system for open air intake. And if that is not common, then you need to go into an HVAC professional or an engineer. There are air engineers available. If anybody wants, you can email me. Always operate a bathroom fan when the bathroom is in use. And sometimes we also at home use ERV or HVR systems, which is heat recovery ventilator or energy recovery ventilators for home. These are not ventilators which Dr. Pandit uses in the ICU, because this is what is going to be the key now as we move into the pandemic. Next slide. So there are a lot of beneficial effects of ventilation. Ensuring that greater number of people in indoor environment, there is a better need for better ventilation. So indoor spaces are more risky than outdoor spaces, and we need to improve that there is proper ventilation. Next slide. So ventilation has 4 steps. First is pressurization. Second is dilution. That means air changes per hour. We need at least 5 to 6 air exchanges per hour, which is recommended by the ASHRAE guidelines. Then we need HEPA, which we all know as filtration or exhaust, and purification of the exhaust air. Sometimes we do it by UV rays also. So filters trap all pathogens. Trap and kill is the desirable. Then there is purification, and then of course we have the heat, ventilation, air conditioning system, and then of course we have purification through HEPA, UV germicidal radiation, or photohydroionization. So we want to improve the indoor air quality through ventilation and filtration, and also give some thermal comfort. Next slide. Though ASHRAE is the world body which has said to reduce exposure to infectious aerosols. It could be a TB aerosol, it could be a respiratory virus, it could be a COVID virus. We need dilution, which means air exchanges per hour, at least 6. Airflow pattern, which means how the air is flowing. Pressurization, negative pressure isolation rooms. This is what Rahul does in his ICUs, OT or procedure rooms. Temperature, humidity, relative humidity should be between 40 to 60%. Not too low, not too high. Very, very crucial. We talked a lot on humidity. Filtration, and of course irradiation. Next slide. So this was what Government of India long time back told us, that for operating air cooling and air conditioning requirements, temperatures of all ACs should be ranging between 24 and 30. The relative humidity must be between 40 and 70 or 40 and 60. Intake of fresh air must be maximized, and recirculation of air should be avoided. Cross ventilation to be adequately ensured, and replacement of air by exhaust fans. Frequent air sanitization with regular cleaning and sanitization of the filters of the indoor unit, and distancing, masks, direct contact of airflow, frequent surface decontamination should also be ensured. Next slide. So one of the ways of protecting from COVID beyond masking and distancing is relative humidity. And that is something which is now worldwide recognized. Next slide. So humidity matters. Relative humidity is a measurement of amount of water vapor in the air compared to the total water vapor in the air that can hold. So colder air retains less water vapor than warmer air. So low indoor air humidity causes vulnerable eyes, causes airway from desiccation and less efficient mucociliary clearance. And this causes elevation of the mucous membrane related symptoms like dry and tired eyes, and they deteriorate work performance. Every indoor house, every person who's watching this show should recognize that if you are sitting in a room and watching this show, that room should be ensuring that there is appropriate humidity, air ventilation, and filtration. And there is a lot of dry air conditions by elevation of indoor air humidity by a lot of non-pharmaceutical interventions, because a lot of viruses like influenza and COVID spread through humidity mechanisms. Next slide. So obviously, drying out of respiratory airways, the viruses dry faster in a relatively higher humidity, and humidity of water droplets and aerosols are closely connected. Next slide. So suboptimal humidity increases risk of spread. If there's very dry and very humid environment, both increase transmission of viruses, including corona and influenza viruses. Lower humidity is called drier air. And in colder winter months, the air tends to be drier. And drier air spreads COVID. So for every 1% decrease in relative humidity, COVID cases can increase by 7 to 8%. There are studies which have been done. and therefore moderating indoor humidity levels is very important. So worldwide now there is a norm 40-60 norm. Try to keep your humidity for optimal health, work performance, and lower risk of COVID or any infection between 40 to 60%, particularly in the winter months. Next slide. So obviously, for that, we often need to ensure that the humidity levels are appropriate. There's a lot of scientific studies which have shown that the correct indoor humidity is vital for infection control. And during the cold months, when heating systems of dry the air, indoor humidity suddenly drops into a dry zone less than 40% relative humidity. And then suddenly you get more flu and respiratory infections in indoor air. For example, in north of India, you are using a heater at your house, the indoor humidity is suddenly going to drop and it is going to go below 40%. And therefore, using humidifiers to put moisture in the atmosphere is the only way to ensure ideal indoor humidity is maintained. So you have humidity controllers available now. You can see here on the graph which AMFS has got PM of 5 per filter and carbon filter and a HEPA filter. So you get these humicovid controllers which can actually control the humidity environment. Next slide. So there is a science behind humidity's fight with flu. This is an old experiment by Noti et al. In mannequin. You can see that mannequins coughed flu from nebulizers into the room at different humidity levels, and then they collected the samples of the aerosol particles. And in this study, they concluded that flu retains its infectious nature in dry air below 40%. 5 times longer than air above humidity, which is relative above 40%. So try to keep your humidity between 40 and 60%. Next slide. So there is very clear science to maintain healthy humidity. A lot of studies have shown now optimal indoor humidity is between 40 and 60. And that will limit and spread of SARS. It will limit the spread of COVID and influenza, and it will maintain hydrated, intact mucosal barriers of all the human beings and make them resistant to microbial attack. Next slide. So obviously, we need to ensure that we need to have those air exchanges per hours. We get dehumidifiers, we get humidity control systems. We need to ensure that there is appropriate air circulation and the outside air fractions are appropriately there, even in the buildings. And also light is equally important. Next slide. The last point which I want to highlight is filtration. Next slide. So remember that in addition to air ventilation from outdoor air, respiratory aerosols are removed by air filtration. So filtered air can be considered as equivalent of air exchanges per hour. And clear air delivery rate, CADR, is a term used to have amount of clean air delivered in spaces by filtration effectiveness. And HEPA filters are there. And then of course we have the exhaust fan which are there. And filters are very, very important. Next slide. So HEPA filters are standardized filters. They are borosilicate microfibers and they are captured and they ensure that they reduce pathogen transmission. Next slide. Final point about air pollution, because we are still having a lot of pollution, whether it is Delhi, whether it's Mumbai, whether it's any part of India. And there are different types of pollutants inside the building, like smoke, allergens, including pollens, carbon monoxide, and nitrogen dioxide. That's why in the school they are putting these carbon monoxide and carbon dioxide meters, moisture, chemicals, and radon or radioactive substances. Next. So obviously, exposure to air pollution worsens COVID. Next. So what can be done to improve ventilation? Increase ventilation through natural means, air conditioning and ventilator systems, filtration, use window air conditioners, air conditioning, exhaust fans, and ensure that there are guidelines which are recommended by the Indian Society for Heat, Refrigeration and Air Conditioning Engineering. So these are all different things which we know which we can do, and we can do it very well. Next slide. So obviously, we need to understand that we must ensure that the right temperature and the humidity is very crucial for survival of the SARS. And very clearly, it has to be maintained between 40 to 70. Next slide. So there's a layered approach, and this is a Swiss cheese model. Physical distance is important, masks are important, hand hygiene, cough etiquette is important, avoiding touching your face is important. If in crowd, you limit your town. But remember, there is a shared responsibility. Ventilation, dehumidification, outdoor and air filtration is equally important. That was my topic today. That is why we discussed it, and it was very close to Dr. Agarwal. And my urge to everybody, whether if you are a doctor, whether you are a, a professional, whether you are in a house, you must ensure that you must ensure that you have appropriate ventilation, appropriate filtration, and most importantly, have 40 to 60% of humidity. Next slide. And we have devices which are available for this. Maybe we'll call an air engineer or expert next in our next show to educate us more on this. I think this is the last slide. So we'll stop here, Rahul. I just gave an
Yes,
overview. I'm sure you see this
excellent.
every day. You see this every day. How do you feel? Because I think we have been only focusing on masks. So I thought we should digress now and talk on air quality and humidity and temperature, because a lot of our people, because of cold, put on the heaters, and the humidity goes below 40% and you actually increase transmission. And already we
Yes,
have a contagious strain. So what
yes.
are your take home points from all this?
No, I think I completely agree with all the points which you said, sir. I think we need to have the Swiss cheese model, as you rightly said. I think the last slide said it all. We just cannot be having one or two strategies and hope that it's going to actually help us, because somewhere the holes will line up and we will have an increase in the transmission. So air ventilation, air pollution, humidity, air exchanges, quality of air, all of the points which you made were very pertinent to the current situation which we are in. And I think this has been fairly understood but poorly implemented. If you talk about this to anybody, nobody actually wants to give a ear to this right now. And I think we need to talk into this direction so that people understand that by simple measures, we've been talking about cross ventilating the room by opening the windows on the opposite direction, so that people that air would flow from one place to the other place. But what that cross ventilation is doing is exactly the 7 or 8 points which you actually mentioned in your talk. It is reducing the humidity, it is increasing your air circulation, it is allowing your air exchanges to happen, and it is improving your air quality. And you add that with a ceiling fan or a table fan in your room, you will have even better air circulation in that room. So right now, if we all have a workspace or an environment where cross ventilation is not possible, and unfortunately the modern buildings are built in such a way that you may have two windows but there is no cross ventilation, there may be angular ventilation. You are working in an environment where air conditioning is the norm, right? Apart from the fact that light may be coming through the windows, but those windows are closed. They are not able to open the windows because of the air conditioning unit. So I think these points which you made are very important. And if we can improve this air quality, indoor air quality, I think we need to look at. I think, sir. In fact, this is just while I'm talking. While on the weather we get reported outdoor air quality index, I think each building should have a indoor air quality index of what they are actually maintaining their building's air quality as, especially the office places. They should be able to say that we are maintaining our air quality index into this particular zone, and that would depend obviously on number of people who are crowding in that room as well, the number of air exchanges which they have maintained, the humidity which they are maintaining, the temperature which they are maintaining, and that would give the safe environment for us. Similarly, aircrafts need to do that. I think aircrafts have now increased their air exchanges. At least that's what's been written in the DCGA rules, that the Director General of Civil Aviation now mandates the aircraft to have almost 8 to 10 air exchanges per minute per hour, as opposed to 5 or 6 which are there in a normal sea level, which is what we are at. So I think it's a very pertinent point which you made, sir. Excellent.
So, a couple of questions for you, Rahul. And before we go to those
Yes, sir.
questions, remember people who can't manage it, we have excellent dehumidifiers and air purification systems available through professional
Yes.
engineers. And there are
Yes.
bodies like AFMPH and all, and ISHRE and ASHRE, laid guidelines which are available through Indian engineers who are dedicated a lifetime for this. And therefore, whether
Yes.
it is your home, whether it is your office, whether it is your school or college, you must ensure that you have those devices if we can't handle it. So a lot of questions have come. Krishna Kumar Mishra is asking, most of the restaurants and malls have central AC. So what should we do?
This is precisely what we need to do. They need to understand that this is equally important. If you are going to allow people to come inside and be in the comforts of a standardized temperature maintained by air conditioning, you need to give a good attention to the air quality. And I am again repeating myself. I think Sashank sir, you need to actually promote this indoor air quality index, and they should be mentioning it, that this is what we try to maintain the air quality index as. And they will have to get the help of these professional engineers. They will have to have certification from these bodies, mandatory. Just like you have a fire certification mandatory, you will have to have an air certification for indoor spaces mandatory. And that can be easily achieved by installing filters, the HEPA filters at the right direction, by making sure that the air exchanges are good, by making sure that your most of these big buildings, the malls and restaurants, actually have a water purification plant, which sort of connects to the air condition. They have these water plants which flow across and cool down the water. I don't know what they're technically called, but I have seen those. You will have to maintain the humidity accordingly, so that the humidity remains at one level. We do that all the time in the ICU, sir. It's not difficult. If you come to my ICU, you go to your Lilavati ICU, you will find a humidity and a temperature meter stuck there. All ICUs maintain the humidity and temperature at a level which we can work comfortably. So the temperature maintained is around 22 to 23 degrees centigrade, and the humidity maintained is around 60 degrees, 60% or so that it never goes down and never goes up. It sort of is balanced quite well. And with that, we are able to bring down the transmission quite well in the intensive care. Otherwise, imagine at times in a holding ICU, you do have an occasional patient who comes positive despite best of our efforts, but none of the other patients catch up the infection. Despite they being all open areas, they are just separated by curtains, and they have just plywood partitions or wood partitions in between. So it is important. It is proving in a hindsight. It has been proven already in the intensive care units and closed spaces that we are able to control the infection down. So there is no reason why we should not be able to do that in all the places where people congregate and want to have a safe shopping experience, safe dining experience. Our children want to go to closed play areas where there are these games and hikes and all the rock climbing and stuff, where they can have a safe environment for them to play.
So Rahul, two medical questions. One is from Suman Suman. Does ferritin increase COVID? I have mild COVID, 24% lung involvement, 6 by 25. Ferritin is 1129. So what should I do? That is the first question.
So yeah. So Sumanji, I think what you need to understand is that ferritin is an acute phase reactant. It is a protein in the body which increases rapidly to any stress, and it is known to increase in COVID-19. Of course, the level of rise of ferritin sometimes can change in different disease processes. For example, some of the autoimmune disease processes like adult Still's disease will have ferritin in 10,000, 20,000s. But in COVID-19, we usually see that ferritin does rise into thousands, and it does rapidly come down as well over the next few days. So rest assured, if it is rising and then plateaued and come down, that means that your stress on the body is decreasing, and the acute phase reactant, which as we just mentioned is a ferritin in the molecule, it will also start to come down. Don't worry about that. Obviously, something which we all relate with ferritin is iron, and that's what ferritin is. Some of the people may want to do iron studies during this acute illness because the hemoglobin.
Hello, I think we lost Dr. Rahul. Manmeet, is Dr. Rahul there? Rituji, is he there? Or should I continue?
I'm sorry, I don't know what happened there. I just dropped off the radar,
Yeah,
and my
yeah, but
internet
you're
is
back.
good. Yeah, I'm back.
That's okay. That
Anyways,
happens. This is the chill effect or the humidity
chill
effect.
effect, chill effect of the humidity. Maybe while talking, because I'm on doing this show on my iPad, maybe my finger just brushed the leave button for a second, and I just dropped off. Maybe it was me. Anyways, So ferritin will come down. That's the main part of it, sir. So now all my chat is wiped out. No, I can see the chat. Okay, sir, I have a question for you. I don't know
Yeah.
whether I can see the chat, but I would like to ask a question for you. That where do you see this air pollution currently, which is there in the cities of Mumbai, Delhi has got a heavy smog, as we all know, or a fog, as we all know. Do you think that in the peak of this pandemic, this smog and fog in Delhi and other places is actually playing a big role in keeping the cases simmering at one level? Or do you think that it is actually not bothering, it is going to follow its natural trajectory of going up and coming down?
So Rahul, this is a very good question. So as you very rightly said, it is not the external outdoor pollution which matters, which is what is displayed everywhere. It is the indoor room air index which is the crucial thing. So as long as, see, we go out for a very short duration of time, and it is definitely driving the numbers. But if your indoors are in the right humidity of 40 to 60, if there is appropriate ventilation, filtration, air circulation in place, I think you can balance it well, and you can decrease the risk of transmission for sure. So that is something which is a given. So Dr. Pandit, you raised a very, very pertinent point. One other clinical question to you, Dr. Pandit. Kritika Chaudhary ji is asking, CRP is 84 and doctor said it's a typical Omicron, but still my father was advised steroids and blood thinners. Is that okay?
So typically, the problem is that lot of people relate rising of this CRP to be a result of, again, as an acute phase marker, which shows that there is severe inflammation going on. And one of the properties of steroids is it's a very potent anti-inflammatory agent. But I would like to just remind all our viewers again that the role of steroids is very important when your oxygen level drops down. So I would like to say that if your dad's oxygen level indeed was a little bit low, when he was having a 6-minute walk test, maybe Kritika ji, then yes, steroids is pertinent. Blood thinners, I think all patients who get admitted to the hospital should get at least some DVT prophylaxis blood thinner, if not contraindicated, because they are sitting in a room, they are not actually mobile, they are just sitting in that bed and doing nothing. But for people who are at home, who are mobile, who are perfectly fine, there is very little evidence to support any form of blood thinner. Having said that, me and Professor Joshi are working on something which we are looking at this blood clotting and all of those aspects in a very, very crucial way. And we would probably come out with some amount of paper which would make us understand better how is the clotting actually happening in this variant, and whether this clotting is actually happening in one of our target organs or not. So I think these are some of the questions which are happening. Um, Sir, there is one more comment by Krishna Kumar Mishra, who says that airports are more vulnerable than the aircraft. I think that is something which we all find it amusing, because airports are actually huge structures with big ceilings and stuff. But he's right, because sometimes they are so crowded that it doesn't matter that how high the ceiling is or how much air conditioning is going on. We are very, very closed in an environment with hundreds and thousands of people. Whereas aircraft, at least everybody is sitting, there is minimum distance between the two, but at least everybody is sitting and wearing a mask. The airport may have different type of people at different scenario. So how do we actually maneuver through the crowds, sir? Day to day, local trains, buses, aircrafts, uh, crowded places like offices, malls, because life will need to go on. We won't be able to just stop everything and just wait for this pandemic to get over.
So two things. One is, Rahulji, we'll have to continue our double masking policy in such situations, because you are now, that can be controlled. But second thing is to control the environment inside that crowded space through ventilation, through filtration, through humidity. It is very, very possible. And because it is possible, we can do it. So I think we need that commitment for our, as you said, the indoor air pollution needs attention. Next time on our Jopa show, we'll try to get an air engineer who can explain us uh, these things in more depth and details and give us solutions, whether it is air conditioned, whether it's a large space, whether it's a small space, whether it's a house room, whether it is a clinic room, whether it is an office space, whether it's a restaurant. How should we take care? This is very, very important, taking care of the air quality. So I think this is really the need of the hour. The reason I ensured that this topic had to be spotlighted is because we are ignoring this, and particularly I felt it relevant because there is the season of winter and dust and chilliness. So I think I will again say COVID is very much around. We still need to vaccinate and mask appropriately. We still need to take care of our ventilation and air. But I think, Rahulji, I would ask you the last question, and you can sum up the show. Ki, it's also important to do correct breathing exercises. As a specialist in critical care, beyond focusing on indoor air quality, humidity, and temperature, which we talked today, what breathing exercises will recommend to normal people and people who are recovering from COVID? That probably is the last question we'll take.
So people who are recovering from COVID, we routinely ask them to do deep breathing exercises using the incentive spirometer. That incentive spirometer generally helps them to improve their lung capacity by expanding their lungs and by allowing that natural lungs to basically function back to normal. However, people who are normal, people who are not having any disease process, it is important that they follow some simple things. I would say that a simple pranayam, which has been taught by the Hindu mythology, is a very, very good exercise. And I think all of us can use that as a simple test to improve our breathing capacity. Another, another one, which is very simple and can be used effectively, is your breath holding time. If your breath holding time you can increase by every other day by 5 seconds only, just by 5 seconds, and see if you can reach to at least 25 to 30 seconds of breath holding, a single breath holding. So you take a deep breath in and you hold your breath, and if you can reach there for 30 seconds, I think that's a very nice thing. You will actually be able to tolerate amount of hypoxia much better than other people. And those people who are able to routinely go beyond 1 minute, I think have got an excellent diffusion capacity. So these are some of the two exercises which you can do, just pranayam and breath holding test. Breath holding test for every day, if you can just increase it by 5 seconds, try to reach 30 seconds. Most of the people should be easily able to reach for 45 seconds to or 1 minute or so. But those who are definitely reaching 1 minute have got a very good diffusion capacity, have got a very good air exchange happening, and they will be able to tolerate hypoxia much better. If at all they have a disease, they'll be able to tolerate, the lungs will be much more stronger and would probably not precipitate into hypoxia at all. I think with this, sir, I would like to just end the show by saying my two comments, which is double masking, air ventilation, indoor air quality index, which Professor Joshi has just elaborated so nicely. And I think we should give it a hashtag and say that it is indoor air quality index, which matters, not the outdoor air pollution index, which is given everywhere. And most important, that do vaccinate yourself. Do not step out of the house unnecessarily. Sir, your last comments and we'll end the show.
So you have said everything, only one focus, 40-60. Keep your humidity at 40-60. Apart from everything else what you said, and stay safe. And wish everybody a very happy Indian Republic Day, which is coming up tomorrow. And thank you so much, Dr. Pandit. And I thank IJCP and Dr. KK Agrawal and his entire team for allowing us to conduct the Jopa show. And wish everybody a very happy Republic Day tomorrow. And thank you, Dr. Pandit, once again.
Happy Republic Day to everyone again. Thank you very much.